Providing aged care services can be complex and has to meet the needs of many different people. Service providers do their best to meet the needs of their clients, but sometimes things go wrong. The Aged Care Complaints Commissioner is an independent service that resolves complaints about Australian government-funded aged care services. We can resolve a complaint in a number of ways, and this is an example of where service provider resolution can achieve a good outcome. Sometimes people are unhappy with the care being provided. This could be someone receiving care in a residential service or in their home, a relative or friend of that person, or even a staff member, and they may be concerned about the consequences of raising their complaint directly with the service provider. So they may make an anonymous complaint to us at the Complaints Commissioner. We can take complaints from people who want to remain anonymous. It just means we can't discuss with them the actions taken by the service provider. We can still resolve their concern by using the service provider resolution process. This process enables a service provider to take the lead on resolving a complaint. The Complaints Commissioner is involved to provide support and ensure the outcomes improve the care and services being provided. This is one such story. An anonymous call was made to the Aged Care Complaints Commissioner, saying they didn't think the cleanliness at a service was up to scratch. Not many details were provided when they lodged their complaint, but they said they wanted something done about it. The complaints officer discussed the complaint with her manager, and they decided it should be referred back to the service provider to investigate. So she contacted the service provider to tell them the complaint was being referred to them for resolution. She asked the service provider to look into the issue and write a report which detailed any actions he took. She also explained that there were templates available to help with the report. Because the complaint was anonymous and only a few details were given, the service provider did an independent inspection of his service, and he noted that the cleanliness did need improvement. He spoke to a few residents who confirmed the cleaning wasn't always done on time. He also spoke to his cleaning staff, showing them the areas of concern, and then he arranged further training for them. New processes were created to ensure the work was done properly in future. The service's cleaning policy was updated, and the service provider monitored the cleaning for the next week to ensure it was being followed. The service provider checked in with the residents again to get their feedback, and they agreed things had improved. Then he completed the report for the Complaints Commissioner using the template, and the report was submitted to the complaints officer. Because the complainant was anonymous, the complaints officer couldn't follow up with them directly to confirm the actions, but she could assess the report with her manager to ensure appropriate action had been taken to prevent the problem from recurring. While doing this, they noticed a couple of instances where the cleaning wasn't done on time. The complaints officer called the service provider to discuss this, and he explained the cleaners had unplanned cleaning to do on those days, which meant they were delayed. The complaints officer suggested these instances be noted in the new processes, so if the problem occurred again or there was another complaint, there would be an account of what happened and why. The service provider agreed this was a good idea and was pleased to have improved his service. The complaints officer and her manager considered the service provider's report and additional information and thought the new processes were reasonable and that the Complaints Commissioner could be satisfied that the complaint was resolved. So if someone has an issue with the care or services provided, even if they want to remain anonymous, the Complaints Commissioner can still take action to resolve the complaint. We also encourage people to raise any complaint directly with the service provider first, and we have some helpful tips on our website. But if extra assistance is needed to resolve the complaint, the Aged Care Complaints Commissioner is always available. There are a range of other useful resources available on our website, with some aimed specifically at service providers and staff.